Greetings, everyone. This is Terry, naturally, with another edition of Terry Talks Nutrition. We're here every Saturday and Sunday morning from 8 o'clock until 9 o'clock Central Standard Time. You can listen to us live locally, and of course, you can listen to us live anywhere around the world. We live stream the radio show to our website, terrytalksnutrition.com, so you can listen live wherever you live. Just adjust your time to be on the same time we are, Central Standard Time in the USA. And also, we archive all of our radio shows. We store them on our site so you can listen to them anytime you want. We also archive our newsletter. Of course, you can subscribe to the newsletter and you can get it every Friday. It's a weekly newsletter. But also, we archive them for you so you can read them anytime you want. Usually a new show or a new newsletter takes a few days to get up on the website, but it'll be there within a few days. You can listen to it again. If you have to leave early or whatever reason you might miss part of the show, you can always listen to it later. And now we have a great show coming up. We're going to talk about one of my favorite herbs. Oh, I have a few of them. It's hard to really choose which one I like better. It's kind of like having kids. You love them all. So I have a lot of likes of my herbal medicines. So we'll talk about one of those today, and that is Boswellia. B-O-S-W-E-L-L-I-A, Boswellia. We'll talk about what that can do for you. And our featured topic today is Boswellia. B-O-S-W-E-L-L-I-A. Actually, it's a resin or a gum, a sap, let's say, from a tree that grows in India. We know that curcumin comes from turmeric, a plant that also grows in India and some other countries around the world. Primarily, it comes from India. Boswellia is a tree. It's a little bit like tapping a maple tree to collect the sap from a maple tree that eventually is boiled down into a syrup. Well, they slash the bark of the Boswellia tree with cutting knives. And this slash in the tree weeps a resin. It's not like boring a hole in a maple tree and collecting the sap, but there are several slashes of the bark of the tree. It doesn't injure the tree, doesn't kill the tree, but the slashing causes the bark to weep. And as it weeps, it drops into a teardrop, and it's called the Tears of India. And this hardened material is scraped off the bark, collected. It's in a hard, kind of a nugget, and then these nuggets are ground into a powder, and that is Boswellia powder. You're going to hear more and more about Boswellia in the future because it's going to be one of those fast-growing botanical medicines. In fact, it has an ability as a botanical medicine that no drug has. And I'll tell you more about that as we go on. Curcumin is exploding. In the last year, it has grown at about 30% growth year after year for the last few years, where all other botanicals are growing at about 5 to 6%, kind of on the average. But curcumin is exploding. And I believe Boswellia is going to be the next explosive herb on the market. There is an organization that records growth of supplements and botanicals, and it's called SPIN, S-P-I-N, SPIN data. And according to the SPIN data, Boswellia products in the joint health category grew 132% last year to a total of $14 million in the United States. lot of the formulas of Boswellia can be used to reduce pain and improve joint structure and function. So it grew at 132%. Of course, that will come down to some degree, but I still think it's going to be on the verge of competitiveness with curcumin. Now, Boswellia, though, is for far more than just joint pain and joint structure and function. And some of the research that is now coming out on Boswellia is in the treatment of cancer, lung disease, liver protectant, heart disease, pain relief, anti-inflammatory. These are some of the critical health benefits of Boswellia. Now I made a comment earlier that I said that Boswellia does something that no drug can do. Curcumin inhibits the COX-2 pathway. The COX-2 pathway produces prostaglandins. And we need those prostaglandins. But when we have an excessive level of prostaglandins, then we have all kinds of conditions that are unhealthy. Cancer, pain, and a number of other things. But there is another pathway that's called 5-LOX, L-O-X. And there is no drug developed today that has any effect on the 5-LOX pathway. And the 5-LOX pathway stops inflammation, just like the COX-2 that produces prostaglandins also inhibits inflammation, or is an anti-inflammatory compound. Now the 5-LOX inflammation has a different effect in the body. One part of the 5-LOX pathway leads to an inflammatory compounds called leukotrienes. Leukotrienes are compounds made by the 5-LOX pathway, which are associated with asthma, allergies, arthritis, and inflammatory bowel disease. No drug has an effect on asthma, allergies, bronchitis, COPD, arthritis, and inflammatory bowel disease. I've run across some people, because people tell me their stories. Whenever I'm lecturing someplace, and I'm talking about the various herbal medicines and what they can do, and I really believe that they are comparable to drugs, and in some cases even more effective than drugs. And we've had research done that shows curcumin and Boswellia outperform Celebrex. Celebrex is a frequently prescribed medication for osteoarthritis. But the combination of curcumin and Boswellia is more effective in head-to-head studies against Celebrex. And actually the combination of the two herbs was more effective than Celebrex in relieving pain, increasing the ability to walk, more mobility, more flexibility, less pain, less stiffness, less loss of mobility, and gave the individual more ability to maintain a healthy life. So this is very important. First of all, it has a greater effect on arthritis sometimes than curcumin. And when you put them together, Boswellia and curcumin together, you have what I call the dynamic duo. It's like Batman and Robin. Oh yes, Batman is great. But Robin makes him better. And Batman makes Robin better. And when you take curcumin and Boswellia together, they make each other more powerful, better than they used individually. So one part of the 5-lux pathway leads to reducing inflammation in the bronchial area, the lungs, sinuses. So it reduces asthma. In fact, I've run across people who tell me, Terry, I started on a very, very powerful Boswellia that is concentrated up to 10 times for AKBA, which is the active component of Boswellia. And they were able to get off all their medication for asthma within 30 to 60 days. Even their inhalers, their rescue inhalers. Allergies, arthritis, Crohn's disease, colitis, irritable ulcer. All of these conditions are under the influence of the 5-lux pathway. So now we have a herbal medicine that outperforms any drug. There is no drug that influences the 5-lux pathway. Now the other part of the 5-lux pathway involves compounds that interfere with the body's ability to kill cancer cells. So it is good for the prevention and the treatment of cancer. Non-steroidal anti-inflammatory drugs, otherwise known as NSAIDs. I'll spell that out. NSAIDs. It's just the abbreviation for non-steroidal anti-inflammatory drugs. Stops inflammation on the COX pathway, but do nothing for the 5-lux pathway. So Boswellia outperforms drugs hands down. This is why asthma isn't treated with ibuprofen. NSAIDs have a lot of adverse effects. In fact, 25% of individuals using NSAIDs drugs experience some kind of side effect, serious side effect, and as many as 5% develop serious adverse events where they need to go to the ER or to the hospital. So we're going to stop right here. I think this year and next year, 2017 and 2018, you're going to see an explosion on Boswellia. Just the last year, it grew at 130-some%. It's going to be one of those new awakening natural medicines. In fact, in Europe, Germany in particular, Boswellia is an orphan drug. What is an orphan drug? Well, an orphan drug or natural medicine is approved by the FDA to be used in a very, very small population of people that have a certain disease. Let's say that we know there are millions of people that have arthritis. There are millions of people that have cancer. But there might be only 10,000 people or less of a certain disease in a country that no drug company wants to spend 10 years and billions of dollars to come up with a drug to treat 10,000 people because they can't make enough money. And this is legitimate. They can't make enough money on a drug like that to spend the investment to bring the drug to market because the FDA requires every drug to go through so many regulations and testing that it costs about $1.8 billion to manufacture a drug, to bring a drug even to marketplace. That takes about 10 years. So nobody wants to treat 10,000 patients. So the FDA and all the countries around the world have what they call the orphan drug status. Orphan, O-R-P-H-A-N, orphan drug status. So that means if you can come up with a medicine, natural or a drug, that can treat 10,000 patients, and you can prove it, the FDA makes it easier. So the drug testing is not as high a standard. You don't have to have such a huge population of studies to satisfy the FDA in the terms of making a drug. So it's easier and cheaper because nobody wants to make a drug for 10,000 people. So the FDA says, if you show us some good studies and it's non-toxic, we're going to approve your product for a drug, for an orphan drug status. Now in Europe, Boswellia is an orphan drug for the reduction of brain swelling associated with tumors and cancer. It is remarkable what it does for cancer of the brain, brain tumors. A clinical study. Now here's where we have small population studies. Not thousands of patients, but small studies. 44 patients treated with radiation therapy for brain cancer received either Boswellia or a fake pill. They wanted to see who got better results. A fake pill maybe is filled with flour, or maybe rice flour, or rice bran, or it's called a sugar pill. Has no activity. So they want to know if it outperforms the Boswellia, or will the Boswellia be significantly more effective than the placebo. The results of the study with Boswellia. Brain tumors, brain cancer. 60% of the Boswellia group had a 75% or greater reduction in brain swelling versus only 26% of the placebo group participants. So it significantly outperformed the placebo, and that is the criteria. If Boswellia was only as effective as a placebo, you might as well give a patient fake pills. It would be almost so inexpensive, it would be ridiculous. If you could make a fake pill filled with rice flour and it worked, and it cured people, wow. So the idea of a placebo study is to make sure that your drug study outperforms very significantly the placebo group. And additionally, in cases of malignant brain cancer, animals treated with Boswellia extract had double their survival time versus the placebo group. When I was out lecturing in Virginia, I ran across a family that had a 33-year-old son diagnosed with a brain tumor. The brain tumor was growing so fast that it was just actually replacing his brain. He was bedridden, could not walk. His left side, his left leg, left arm was completely useless. And the doctors gave him, after their diagnosis, their treatment, they went through the whole gamut of drugs and whatever. They gave him 4 to 6 weeks to live. The mother told me, she said, I started him on 1 curcumin, 1 Boswellia soft gel capsule of each, 3 times a day for the first week. Now she said, I know I only had 4 to 6 weeks to try to do whatever I thought I could do for my son. I did not want to lose him, but I didn't have much time. So the second week I panicked, and I doubled the dose. I gave him 6 capsules, 6 soft gels of curcumin, 6 capsules of Boswellia. The third week, I gave him 9 a day of curcumin and 9 a day of Boswellia. And in 8 weeks, he was up out of bed, walking around, full use of his left side of the body. And when I met her, he was with her. The 33-year-old son was with her. And he said, do you mind? I'd like to sit down. He said, I'm tired. And I said, okay, no problem. He said, I was out kayaking all afternoon with my nephew, and I'm just overly tired. I overdid it today. But here he is, in the 8th week, 9th week, he's a survival. Now, this is not a study. This is certainly just, I'm just telling you what happened. I can't prove that anything happened through the curcumin or the Boswellia, but believe me, I know it did. I am convinced, absolutely. Because those stories I hear all the time when I cross the country. People tell me the results they're getting with curcumin and Boswellia. They're lifesavers. Now, I've kept in touch with this family because I want to know how he's doing. And he's doing fantastic. And to this day, he is still taking 9 soft gels a day of each. Now, I talked to a few scientists and told them the story, and they said, well, have her cut the dosage down. She's wasting her money. Maybe he only needs 1 or 2, not 9. So I called her and I said, why don't you just cut your dosage down? Maybe he doesn't need that anymore. And she said, I will never cut it down. It's what saved his life. I can afford it. I don't want anything to come back in his life that will threaten his life. So he's still on 9 a day. And he's a miracle. Was it the curcumin and Boswellia? I can't say that. But I personally am convinced of that. Now here are some more uses for Boswellia. I am spending a lot of time today on Boswellia. I probably won't get to any of my other topics. But as much as I love curcumin, and as I said before, I have a lot of children I love. And all these herbs are like my children. Because I see what they do. I talk to people around the country, around the world. And I talk to scientists that are doing the research. I'm not a scientist. I don't have any medical degrees. I don't have any kind. I went to high school. Barely got out of high school. Told me I should never go to college because I'd never make it through. But I have learned from scientists, and I've learned from families, and I've talked to researchers, and I've been to India. In fact, I was in India a couple of weeks ago. And I go to these extraction companies, and I go to the researchers, and I talk to the scientists, and the research coming out of India for the botanical medicines. It's a garden of botanical medicine because their countryside is so lush with vegetation. Herbs galore. And they've been studying Ayurvedic medicine for thousands and thousands of years. It's a medicinal, botanical medicine paradise. It's a fantastic country. I love India. I love the people of India. And they're giving us the herbs of curcumin and Boswellia. They're giving us like amla, ashwagandha. These are other herbs I love. And I do love grape seed extract. These are my children. So I love them all. How can you not love all your children? So now, more uses for Boswellia. Cancer treatment and prevention. In a cell study of pancreatic cancer, exposure to AKBA, 4 letters. AKBA. This is the abbreviation for a boswellic acid that is a constituent of the Boswellia. Boswellia is made up of a group of boswellic acids. And this is the primary boswellic acid. It is what all scientists around the world believe is the most active form of the boswellic acids. It's the key compound in Boswellia that suppresses cancer of the pancreas and prevention of cancer cell formation by 50 to 90%. Normally in Boswellia, AKBA is there at about 1 to 2%. to make it a stronger anti-inflammatory and a more powerful cancer suppressant, they raised the level of the AKBA up to 10%. Why not more? Well, 10% is the maximum that still maintains a natural ratio of boswellic acids. I've seen some companies go up to 30%, 60%, and they also have AKBA at 90%. But then you're using a pure, isolated compound, and you're not getting all the other constituents of the boswellic acids. You know, if you're going to have a family, it takes more than one. And this is the family of compounds that makes boswellic acids and Boswellia so powerful. Now, this is only a cell study. This is not a human study or even an animal study. But this is where you start to find out how effective a compound can be. So this is a cell study of pancreatic cancer, one of the most harsh forms of cancer. Most people don't live very long with pancreatic cancer. 6 months, maybe a year, not much more. It grows so fast. But Boswellia, in the cell study, suppressed pancreatic cancer cell formation by 50 to 90%. So even if you are, let's say you have cancer, and you're going to be treated by your physician, and that's okay. I mean, I'm not going to tell you not to. It's entirely up to you to work with your physician and then make the choices that you think is best for yourself. People ask me all the time, Terry, my doctor wants me to go on chemotherapy, wants me to take radiation. Should I do it? I don't know. I know what I would do. I would not do any radiation. I would not do any chemotherapy. I would make changes drastically in my diet, which I don't think I have to do more than what I'm doing now. But I would make sure that I took curcumin, I took Boswellia, and I would take them in very large dosages. But if you want to be treated with chemotherapy and radiation, or whatever it might be, you can still take curcumin and Boswellia. In fact, there are studies that show it makes the cancer treatment more effective and less toxic to the body. And they can get by with a lesser dose. Doctors are always asking the researchers at Baylor University and MD Anderson Cancer Treatment Center in Houston, Texas, whether or not it's okay. And all the research says, yes, it's okay. But you know what? When you decide whether or not a medication, chemotherapy, radiation, or whatever it might be, should it be used by you? That's entirely between you, your physician, and God. And I would say pray about it. Don't listen to everybody else that is telling you what you should do. It's your body. You're going to live with whatever happens. Even whether or not, if you live and survive, it's your choice. If you don't, it's your choice. Whatever you do, it's your choice. But that choice should be made with the advice of your physician, you examining and analyzing all the data that you got from your physician, and then go into deep prayer. Meditate. Should I do this? Lord, give me a sign if I should be doing this or not. You have to live with it. Your doctor goes from patient to patient to patient. And when a patient dies, the doctor goes to the next patient. If the doctor could guarantee you that you would live with the treatment, go for it. But you have to live with whatever happens. The doctor walks away without any responsibility. I know the doctor has good intentions. Highly educated, highly knowledgeable. But we have made no progress in the treatment of cancer. 50 years, we're no better off today than we were 50 years ago. Because cancer is a number of diseases, and it's caused by our lifestyle. It's caused by the pollution, pesticides, chemicals, sodium fluoride in drinking water, chlorine in drinking water, all these chemicals, and then the lack of a proper diet to at least try to rid our body of these toxic chemicals. Cancer was 1 out of 25 or 30 in the early 1900s. Now it's 1 out of 2. And they predict by the year 2050, everybody will have cancer, if we don't change what we're doing today. Cancer is caused by not eating the right diet, by not choosing the right lifestyle choices. It's not something that attacks us. It's not something like we catch. And that's why it takes 30 to 40 years for cancer to become diagnosed. Because we have to do so much damage internally to create healthy cells to turn cancerous. In an animal model of pancreatic cancer, animals receiving AKBA had a 70% reduction in tumor size versus untreated animals. In the case of asthma and allergies, 70% of asthma patients treated with Boswellia had improved lung function versus only 27% of participants in the control group. Colitis and all inflammatory bowel disease, IBD, inflammatory bowel disease. 63% of patients with chronic diarrhea and colitis achieved remission after just 6 weeks of Boswellia treatment versus 26% in the placebo group. So for the Boswellia, that was a significant increase in benefits over the placebo. In arthritis and joint diseases, after treatment with Boswellia plus curcumin, now here's what I've said before, when you put the two together, and this was a study of Boswellia and curcumin together, compared to Celebrex. Celebrex is probably the most prescribed drug to patients who are diagnosed with osteoarthritis than any other medication that I'm aware of. It is frequently advertised on TV. But the treatment with Boswellia plus curcumin, 93%, almost 100%, 93% of people with arthritis of the knee could walk 1,000 meters versus just 85% of those who took Celebrex. So the Boswellia and curcumin combination outperformed Celebrex. And then the big bonus, there are no side effects to Boswellia and curcumin, where there are many serious side effects when taking Celebrex. So this is a huge advance. And you're going to see, in fact, there are drug companies that are trying to discredit curcumin and Boswellia because they see the writing on the wall. They know these work, and they can't patent them. They are trying to make synthetic versions. Really, truly, they are trying to make synthetic versions of natural herbal medicines. Because then they can patent them, and then they can charge whatever price they want. So if they can't do that, then they're going to come up with studies that prove, oh, it doesn't work. But they actually make the studies not work. And then they show those studies to the media. And you know what the media does today? They'll print anything to sell their news. So if you see any discrediting of curcumin and boswellia, flush it down the toilet, because that's about where it should be. Because drug companies will make studies that will repeatedly discredit herbal medicines because they know that herbal medicines is a threat to their business. But now I want to tell you how to pick a Boswellia extract, but I'm all out of time. But I'll tell you what, listen tomorrow. Listen on Sunday, and I will tell you how to pick the best Boswellia extract and curcumin that will give you the results that I've already talked about in this hour. It is too important to miss this. So join me tomorrow, and I will talk about the proper Boswellia extract you should use. With that, my friends, I'm all out of time. Just want to say, do the things you can do to be well. Say a prayer. God bless you.